Right, so now let me describe another CNS infection after the tuberculosis. As the neurosyphilis, the Treponema pallidum, the bacteria affecting your central nervous system, and obviously, look better what happens. It progresses in three steps. Firstly, you develop the primary syphilis, right, which is mainly, the syphilis of the genitals. Then it actually spreads a little bit, involves multiple systems. So then it becomes the secondary syphilis, right? Then a very much complicated last stage comes, that is the tertiary syphilis, where there is the formation of the gumma formation, granulomas, right? So in this particular stage, tertiary syphilis, your CNS is involved, and that is what we call the neurosyphilis, right? So the neurosyphilis is simply the manifestation of untreated tertiary stage of the syphilis, not the primary, not the secondary, tertiary stage of the syphilis. Okay, once this bacteria is in your CNS, what it does actually, what are the three patterns? Okay, let's suppose this is your brain, below is the spinal cord, tertiary stage, you are it, and the bacteria is now into your CNS. What you think it will do with your brain and all? Number one thing is the meningovascular neurosyphilis, that is the infection involving the meninges and the blood vessels. Number two, there is the paratic neurosyphilis, we'll talk about this. And number three is the tabes dorsalis. These are the three things that can possibly occur while you are suffering from the neurosyphilis. One is the involvement of the meninges and the blood vessels. Number two thing is the paratic neurosyphilis. Number three is the tabes dorsalis. We'll talk about this obviously in detail. The patient with HIV, they are obviously at increased risk of neurosyphilis. Obviously with HIV you are immunocompromised and the risk of developing infections is obviously high. So with HIV there is increased risk of neurosyphilis because of less cell mediated immunity. While you are suffering from HIV AIDS, obviously your immune system is weak, your cell mediated immunity is low, and you develop neurosyphilis, right? Particularly acute syphilitic meningitis or meningovascular disease. So if you are a HIV patient and you develop neurosyphilis, which is more likely that with HIV you will develop the neurosyphilis, and what manifestation will you see? Now, meningovascular disease or the acute syphilitic meningitis, the inflammation of the meninges, acute inflammation of the meninges by the Treponema pallidum. Let's talk about the morphology. We'll talk about all these three in detail. One is the meningovascular neurosyphilis, beta. It is obviously the name indicates the involvement of the meninges, involvement of the blood vessels. So it's actually the chronic meningitis, the inflammation of the meninges. Where exactly? At the base of the brain, जो सेरिब्रल ऊपर से कन्वेक्सिटीज़ होती हैं, राइट ओवर हेयर यहाँ पे, या फिर ज़रूर नहीं है कि ब्रेन की मेनिंजीज़, स्पाइनल कॉर्ड की जो लेप्टोमेनिंजीज़ हैं अंदर की दो, एरेक्नॉइड और पिया मेटर, वो भी इन्वॉल्व हो सकती हैं. मेनिंजीज़ एट द बेस ऑफ द ब्रेन, meninges at the cerebral convexities, or meninges of the spinal cord. You understand what I'm trying to say? In the meningovascular neurosyphilis, there has to be the involvement of the meninges, no doubt. There has to be the chronic meningitis, but where exactly the meninges are involved? At the convexities, at the base of the brain, the meninges and the spinal meninges. Okay. And what about the second part, vascular part? There is obliterative endarteritis. And in this neurosyphilis, this obliterative enteritis is said to be the Hübner arteritis. What is it said to be? Hübner arteritis. What is Hübner arteritis? Hübner arteritis is called Hübner arteritis. I think it's not good. Hübner arteritis is the obliterative endarteritis. Is the inflammation of the blood vessels in the meninges. Is the inflammation of the blood vessels in the meninges, particularly due to what? Particularly due to syphilis, neurosyphilis, right? The Treponema pallidum. Okay, so it is accompanied by the distinctive perivascular inflammatory reaction rich in the plasma cells and the lymphocytes. Okay, right. Two things so far I have discussed. One is the, look, इसका नाम ही बड़ा clear है, meningovascular neurosyphilis. Firstly, I told what's happening with the meninges. There is chronic meningitis, the inflammation of the meninges. Where exactly the meninges? At the base of the brain, at the cerebral convexities, okay, and the spinal meninges. ठीक है? What about the second vascular wala part? There is obliterative endarteritis. The obliterative endarteritis, the inflammation of the small blood vessels which is produced by the neurosyphilis, it is said to be the Huebner arteritis. Said to be the Huebner arteritis. And if you see the meninges, if they are inflamed and the little blood vessels right over here, you see there is the obliterative endarteritis of these blood vessels, and there is the perivascular inflammatory infiltrate. Around this blood vessel you will find perivascular inflammatory infiltrate rich in what cells? Plasma cells and the lymphocytes. Plasma cells and lymphocytes. तो ये दो बातें समझ आई बेटा. इसके बाद there is the formation of the cerebral gamma. ग्रेनुलोमा बनते हैं सेरिब्रम के अंदर, ठीक है, एंड दे आर प्लाज्मा सेल रिच मैस प्रेजेंट इन द मेनिंजीज एंड एक्सटेंडिंग बिलो इनटू द सेरिब्रल पेरेन्काइमा. ठीक है, ये क्लियर हुआ बेटा मेनिंजोवास्कुलर सिफिलिस? आई डोंट थिंक दिस इज रियली डिफिकल्ट. सम चेंजेस इन द मेनिंजीज, सम चेंजेस इन द ब्लड वेसल्स. गम्मा बनते हैं ग्रेनुलोमा पहले मेनिंजीज में, वो एक्सटेंड करके नीचे आते हैं ब्रेन सब्सटेंस के अंदर, सेरिब्रम के अंदर. गुड हो गया. चल, right after the meningovascular neurosyphilis, what is another manifestation of the neurosyphilis? Paratic neurosyphilis. Just a second. Paratic neurosyphilis. Paratic neurosyphilis is the invasion of brain tissue by the treponema pallidum. The previous one we discussed here, that was the meningovascular neurosyphilis. That was the involvement of the meninges and the involvement of the blood vessels of the meninges. But here, there is not the involvement of top three meninges, but there is the involvement of this thing, this cerebrum, the brain tissue की involvement होती है. ठीक है. Clinical manifestations insidious but progressive. There is cognitive impairment क्योंकि यहाँ पे meninges involve नहीं हुई, यहाँ पे brain tissue cerebrum involve हुआ है, इसलिए cognitive impairment with mood alterations including the delusions of grandeur. Delusions, we'll better talk about this in psychiatry in the upcoming lectures inshallah. This is a false belief, firm belief on something which is not realistic. Okay, so these are the cognitive impairments, mood alterations, especially the delusions of grandeur that terminate in the severe dementia. शुरू में it starts with the delusions and it ends up with severe dementia. ठीक है, that is the general paralysis of insane, complete loss of the memory, okay. So yeah, are you getting my point actually beta? What I'm trying to say is, can you find out the difference between the top one and this one? There was the involvement of the meninges and blood vessels. Here is the involvement of the brain tissue. This is the reason patient is coming to you with some neurologic sign symptoms like the cognitive impairment, right, and the dementia and all. There is actually the parenchymal damage. Obviously, because the infection is right over here and there has to be the damage to the brain parenchyma, damage to this substance, especially the cerebral cortex. और cerebral cortex में जो frontal lobes होते हैं उनका damage ज़्यादा होता है. आप समझ रहे हैं बात बेटा? So how easy it is. I mean, previously we discussed something which was involving the meninges, blood vessels, and lots of things were happening. And now here in the paratic neurosyphilis, there is involvement of the brain parenchyma, especially the cerebral cortex or the frontal lobe. Yeah, that's it. And this is the reason patient is coming to you with the cognitive impairment. Yeah. So here, before we go to the tabes dorsalis, you must see what type of parenchymal lesion. I told you beta that right over here is your dura mater, then comes the arachnoid mater, then the pia mater, below is the cerebral tissue. जो अभी हम डिस्कस कर रहे हैं पैरेटिक न्यूरोसिफिलिस, उसमें किस चीज़ की इन्वॉल्वमेंट होती है? इन मेनिंजीज की? नो, सेरिब्रल टिश्यू की, स्पेशली फ्रंटल लॉब की. क्या डैमेज होता है पेरेन्काइमा के अंदर बेटा? नंबर वन इज़ द लॉस ऑफ द न्यूरॉन्स, और जहाँ पे न्यूरॉन्स लॉस होते हैं उनके अराउंड ग्लायोसिस होती है. that is the proliferation of the microglial cells, right? And right at that region of the injury, there is the iron deposition. It is the result. मैं बताता हूँ ये क्यों होते हैं iron deposits, but ये जो iron deposits होते हैं उनको अच्छे से आप स्टेन करके विजुलाइज भी कर सकते हो, ठीक है? Look beta, what happens is, just let me describe you in much better way. These are the top three, meninges, good looking dura at the outermost, then comes the nice little baby, and this is your beautiful arachnoid matter below which the CSF runs, and I really like it. And just is gonna be this one, the PA matter, the very close to your brain, and this is the cerebral tissue. And in the paretic neurosyphilis, what part is affected? The cerebral cortex are affected, especially the frontal lobes. The lion is present right over here. So, okay, this is the site of lion. Let me show you this site of lion in a much better way. This is the site of lion now. So what happens right over here is, if we see it on the screen, then you will see there is these are the neurons. The neurons are damaged. These neurons are damaged, and around these damaged neurons, obviously the neurons are being damaged, so the microglial cells will be clustered around these neurons to eat up these dead neurons. And also, because of the injury, the blood vessels which are running by, they become leaky due to the inflammatory reaction. So when they become leaky, the iron also leaks out of this. The iron leaks out of this, right? And the iron, when leaks out of this, iron starts depositing over there, right? Iron starts depositing over here. So yeah, now you're understanding the picture. I hope it is easy now. So yeah, loss of neurons. Number one thing, these neurons are gone. Proliferation of the microglia. You can see these blue, nice little healthy microglial cells. And the iron deposits, these are the result of small bleeds from damage to microcirculation. This microcirculation running near, there is obviously a leaky they have become. So the iron is being, स्मॉल ब्लीड्स हो रही हैं यहाँ से, तो आयरन भी बाहर आ रहा है. और इस आयरन को डेमॉन्स्ट्रेट किया जा सकता है, विजुलाइज किया जा सकता है विद द हेल्प ऑफ प्रुशियन ब्लू स्टेन perivascularly in the neuropil, whatever it is, but with using this Prussian blue stain, you can actually visualize this iron deposits. Okay, so it is easy now. Lastly, in the neurosyphilis beta comes the tabes dorsalis. The tabes dorsalis, but before we go to this, what was the meningovascular neurosyphilis? Involvement of the meninges, that was the chronic meningitis and the obliterative endarteritis. Then we discussed the paretic neurosyphilis. There was involvement of the cerebral cortex, particularly the frontal lobe, in which the lions were loss of the neurons, proliferation of the microglial cells around, and the leaky blood vessels, small bleeds, जिसकी वजह से iron deposition होती है. ठीक है बच्चों, इस तरीके से. Then comes the tabes dorsalis beta. Tabes dorsalis is the result of damage to the sensory axons in the dorsal root of the spinal cord. Tabes dorsalis is restricted particularly to the spinal cord. The two top above variants were, most of them were kind of producing some business in the brain, but this has to do the entire thing with the spinal cord. There is the damage of the sensory axons, the axons which are actually coming to the spinal cord in the dorsal root. They are damaged, resulting in, obviously, when the sensory neurons are lost, there's something big has to happen, obviously. The sensory neurons bringing the sensations to the dorsal root of the spinal cord, they are gone, man. So there has to be something. Okay. Number one, impaired sensation of the joint position, because these are the sensory neurons. They are bringing some sensation of proprioception. So once these sensory neurons, which are bringing the information to the dorsal root of the spinal cord, you think once these babies are lost, they will be able to bring any information anymore? No. So joint position ki there will be impaired sense of joint position. You know where exactly your joint position is, right? So that sense of position will be lost. Number two will be the ataxia. The posture and the movement will be affected surely. That is the locomotor ataxia. Loss of pen sensation. Obviously the sensory fibers which are bringing information to the spinal cord, if they are lost, तो आप पीछे prick करें, कुछ भी करें, पेन सेंसेशन नहीं होगी. जिसकी वजह से अगर आप देखें ना, फ़र्ज़ करें अगर मैं यहाँ पे पिंच करता हूँ बहुत ज़्यादा, तो सेंसिटिव फाइबर्स यहाँ से जाते हैं, स्पाइनल कॉर्ड में इन्फॉर्मेशन लेके जाते हैं और फ़ौरन से मैं ये जो सोर्स ऑफ स्टिमुलस है वो हटा देता हूँ। लेकिन अगर सेंसिटिव फाइबर्स ही ख़राब होंगे तो फिर मैं यहाँ पे पिंच करता जाऊँगा और ये मेरा पूरा हिस्सा डैमेज हो जाएगा क्योंकि मुझे पेन ही नहीं हो रहा। तो इसी वजह से यू सी हेयर देर विल बी लॉस ऑफ पेन सेंसेशन, जिसकी वजह से देर विल बी स्किन एंड जॉइंट डैमेज होता रहेगा और पेशेंट को पता भी नहीं चलेगा क्योंकि पेन ही नहीं हो रहा ना। और जो जॉइंट्स बन जाते हैं उस कैटेगरी के जॉइंट्स को हम चारकट जॉइंट्स कहते हैं, ठीक है बेटा। अदर सेंसरी डिस्टर्बेंसेस इंक्लूड द लाइटनिंग, pains and absence of the deep tendon reflexes. So obviously due to the loss of the sensory fibers, the deep tendon reflexes are also lost. If you look at this lesion microscopically, there is a loss of both axons and the myelin sheath in the dorsal root. So if you see, this is good looking spinal cord, central canal, nice butterfly shaped, sensory fibers coming right like this, the sensory fibers all the way is coming to the dorsal root, bringing some information of the proprioception, pain sensation, some reflexes that actually synapse in the spinal cord. So everything will be cut off. If there is damage to this baby, this fiber bringing all the information all the ways to the dorsal column of the spinal cord, if this boy is lost, so no information will be carried from here to here. You keep on damaging this area, the pain sensation will not be carried here and you will keep on damaging this area. Okay, so we're talking about the microscopy. What actually is the problem here in the sensory fiber? जो एक्सोन्स इस फाइबर में मौजूद हैं वो और उनके अराउंड माइलिन शीथ दोनों लॉस हो चुकी हैं, जिसकी वजह से ये पूरा एरिया जो है डोर्सल कॉलम ऑफ स्पाइनल कॉर्ड का वो पूरा उसका पेलर हो जाएगा एंड देयर विल बी एट्रोफी इन द डोर्सल कॉलम ऑफ द स्पाइनल कॉर्ड. व्हाई एट्रोफी? बिकॉज बहुत सारे एक्सोन्स तो लॉस हो चुके हैं, उनकी माइलिनेशन लॉस हो चुकी है. सो दिस रीजन विल बिकम वेरी मच पेल एंड वेरी मच atrophied. Okay, so that was my best beta for neurosyphilis of the CNS. I hope you are clear with this. We'll talk about other CNS infections in the next video.